So, こんばんは。アニョンハセヨ。ニハオ。Good evening, good morning, everybody. This time, I'd like to talk about the Alzheimer disease in English because we are taking care of not only Japanese but also many foreign countries people. So I want to present most recent last data for everybody all over the world. So I use English. My native is Japanese, so I'm afraid that I could reach my true meaning to you, but let me do this presentation. So my name is Dr. Arai, the director of ALZCLINIC Tokyo, very near from Tokyo Station. And I've been taking care of people with dementia, especially Alzheimer's disease, for more than 45 years. So just recently, we just arrived at the very high level of treatment that is anti-amyloid beta immunotherapy. And that is very different from the previous therapy. And that is just like donepezil, galantamine, ixelon, or memantine. Those drugs are mainly anticholinergic drug and just symptomatic drugs. But this time we got the new drug that is immunotherapy. So the immunotherapy means that catch up the amyloid beta, then the deposition of amyloid beta in the brain will be decreased by those therapies. So these drugs named LEQEMBI and KISUNLA, it's a trade name. LEQEMBI from Japanese company Eisai and Biogen, and KISUNLA from Eli Lilly company. In Japan, at the end of last year, at the end of December, the KISUNLA, LEQEMBI was approved officially. And just few days ago, KISUNLA was approved in Japan officially. And today is the first day that the Eli Lilly distribute the KISUNLA. From today, so we can use 2 immunotherapy drugs. So today I want to explain the meaning and the difference between 2 drugs, etc. And if you have any questions, please send the message to me and I can answer if possible. So anyway, the LEQEMBI and the KISUNLA, the efficacy means that decrease amyloid deposition in the brain. The ability of the the decrease the 60 or 80% of the amyloid deposition is a decrease. So the efficacy of both drugs are almost same, and also the clinical features, symptoms, the almost same, because the decline of the disease, cognitive dysfunction, decline of cognitive dysfunction is slow compared to the placebo. That means that, almost 7 or 8 months, the decline is slow. So, and that means that if used continuously, the 2 or 3 years, the condition decline is slow. So that means that the amyloid deposition decrease and decline comes slow. So that is a clinical efficacy. That is almost the same for both drugs. And side effects, it's two type of side effects. One is injection reaction. This is just come from the injection first night. But not so severe one. So high temperature, 37 Celsius or 38 Celsius. But usually we can use the acetaminophen, for example, for such injection reaction, and then the next stage the patient recover. So most of the people have such injection reaction, maybe first or second or third injections. After that, it's very rare to have such injection reaction. And the second side effects is more severe. Is that ARIA, amyloid-related image abnormalities. So that is found in the MRI findings. Usually first 2 or 3 months and or until 6 months from the beginning of the injection, we usually find. But the percentage of the area is 10 to 20% of the people who receive the injection of the KISUNLA or LEQEMBI. And the percentage is almost same between both drugs. So, and even though one may have such area, most of the patients have no clinical symptoms. 10 or 20% suffer from headache or light fever or dizziness or etc. But if area is severe, area is brain edema or microhemorrhage. That is, if the area is severe, we stop the injection. And after 4 months, the area will be disappeared and the MRI finding. So then at that time, we can restart the injection. So area is one of the serious problem in this immunotherapy, but there is no person in the clinical trials of the that is a final clinical trials before approval. No death was found related to this immunotherapy, or 1 or 2 persons in the KISUNLA therapy clinical trials. So if the area happens, we do, of course, we pay attention, but don't be so serious. And let's see the course, natural course. It will recover within the 4 months. So, in terms of the side effect, as I said, the injection reaction. And the second is area, amyloid-related imaging abnormality, both side effects. But efficacy of the immunotherapy is much bigger than the risk. So benefit is bigger than the risk. So that means the drugs is firstly in America approved, and then the second country is Japan. For LEQEMBI, already, as far as I know, the 7 or 8 countries have approved the use of LEQEMBI. America, Japan, Korea, China, Taiwan, England, just recently France, and etc. I don't clearly remember all of the countries who accepted LEQEMBI. But KISUNLA is only 2 countries, America, USA, and Japan. So I just explained that the efficacy and side effects are all same between the 2 immunotherapies. Then I explained the difference. Okay. One of the big difference is that the frequency of the injection. LEQEMBI should be used every 2 weeks. So that means that twice a month. KISUNLA is every 4 weeks. So that means once a month. So it's a big difference. Why there is such difference is that the protocol of the clinical trials, each company made the protocol at the final stage of the clinical trials before approval. At that time, the protocol is the difference. So LEQEMBI was used every 2 weeks, and the KISUNLA was planned to use every 4 weeks. That's a difference. So in the real world use, the protocol is a very, very important. So we have to follow the protocol of the clinical trials. Yeah. Then second different point is that injection time. I mean, LEQEMBI 1 hour drip injection. Okay, KISUNLA is only 30 minutes drip injection. So 1 hour versus 30 minutes. So every 2 weeks, 1 hour drip injection. Every 4 weeks, once a month, 30 minutes drip injection. So, and the waiting time after the injection, 1 hour after drip injection is needed for LEQEMBI, and 30 minutes waiting time after the injection for KISUNLA. So I repeat again, LEQEMBI twice a month, 1 hour drip injection, 1 hour waiting time, versus KISUNLA once a month, 30-minute drip injection, the waiting time 30 minutes. So I have no idea, but I don't like to suggest which is better, because from the scientific viewpoint or medical viewpoint, efficacy and side effects are most important. And in terms of side effects and efficacy, two drugs are same. So then how patient or families should decide which is better or not? From the scientific viewpoint, is both. So then the lifestyle, twice a month or once a month, visit the clinic or hospital, which is better for each person or each family. I recently found that visiting hospital or clinic is not only just a clinical purpose, but also the very good chance to make up everyday active life and plan many things and visit and eat good foods, restaurant, and sightseeing. So it's a good chance to visit hospital. So twice a month, maybe better for such active families, and make the schedules maybe very good for brain function training. Planning is very important for our human brain, especially frontal lobe. So visiting hospitals twice a month, maybe very training planning for patients and families. But from far place, once a month is much more convenient for patients and families. So which is better? I don't know. And the patients and families can select which drug, which injection is good. Yeah. So I have been treated more than 100 people with LEQEMBI since the end of last year. Um, Out of them, only 3 persons had severe area. At that time, I stopped the injection. But after 4 months, area disappeared and they started again. So, as a consequence, now I'm very satisfied the LEQEMBI treatment. And I did say that today we got the KISUNLA. Now, at my clinic, almost 10 people are waiting for KISUNLA. So we will start the KISUNLA injection from the beginning of December. So the reason to select LEQEMBI is that it's safe compared to the KISUNLA because last year started the LEQEMBI treatment. So we know the safety of the LEQEMBI. So people are likely to select LEQEMBI. But other people select KISUNLA. They choose KISUNLA because it's very convenient, once a month, 30 minutes. So we are waiting the result of the real world efficacy and the side effects. So finally, my clinic is just near from Tokyo Station. Everybody visits my clinic without umbrella if it rains. So my clinic is ALZCLINIC. ALZ doesn't come from Alzheimer's disease, but active life with zeal. That is my hope, active life with zeal. And my clinic is not only for Japanese, but also for East Asian people, or Middle East people, or European people, or American people. Actually, this year, at the moment, currently, five foreigners are visiting our clinic for, just wait a moment, for LEQEMBI treatment. So, as I said, KISUNLA is only once a month, so it's very convenient for foreigners, especially from the near countries, Korea, China, Taiwan, or East Asian countries. We welcome foreigners for KISUNLA treatment. And we have the PET scan and MRI machine by ourselves. So if visit our clinic at the first day, we can do the PET scan and MRI the next day. So we can get the result the second day, whether you are needed or not, the immunotherapy. So we can get the result of amyloid deposition. You have the amyloid deposition or not the second day. Then, if you wish, the third day we can use the LEQEMBI or KISUNLA treatment. We can do it. Very, very fast protocol. We can react very quickly. So if you are interested in the amyloid PET scan, for if you want to see the risk of the Alzheimer's disease, the amyloid deposition starts more than 20 years before the onset of Alzheimer's disease. And such a prestige of Alzheimer's disease is the best time of the immunotherapy. After the onset of Alzheimer's disease, the immunotherapy doesn't work well. So our clinic is just open for all people from all over the world. And yes, the Tokyo Station is the capital of the Tokyo, the main station, and the international airport is Haneda. That is only 30 minutes from Tokyo Station. So our clinic is also very near from the international Haneda airport, Tokyo airport. So, and I'll show you my clinic. Yes, this is my, you can see. Yes, this is the address of our clinic. So if you have any questions or if you want to get more information, please contact me anytime. We welcome all of you from the world. And I hope that these new drugs, new therapies will make your life fruitful and you can enjoy your everyday. Yes, I hope that LEQEMBI and KISUNLA will work very well for the visitors to my clinic. Yes, so we can welcome you, so you can get any information from my clinic. So please contact us if you have any questions. Yeah. So I would like to finish my presentation today. And again, thank you very much for attending this session. And I hope that all of you enjoy your life every day. So I hope that I'm looking forward to seeing you anytime, any place, especially in my clinic. Welcome. So bye-bye and see you again if possible. Bye-bye.